Within integrative medicine, we treat multiple sclerosis with a different approach. Let's take a look at this together. Multiple sclerosis, or MS, is a dreaded disease in the nervous system. The first symptoms can be quite different. It can start with a tingling sensation in the hand, or with muscle weakness in the arm or leg. It can start with eye disorders. Suddenly you no longer see clearly, possibly you see double. Something is disturbed in the eyesight. When you have such symptoms, you have to be sure to conduct a neurological evaluation. The disease usually progresses in periodic exacerbations. That means a push occurs. You have 1, 2, 3 weeks of intense neurological symptoms, which then go away again. But there is also a form that slowly progresses without these attack phases. But this attack form is the more common one. Now let's look at exactly what happens in the nervous system. This is a nerve cell here, a brain cell. They are very complex. Here is the cell nucleus. Such a brain cell has dozens of little arms where the next nerve cell docks onto again. These are synapses. We probably have more synapses in the brain than there are planets and stars in the universe. This nerve cell has a tail, a long thread. This thread can go all the way down the spinal cord, or be just a shorter tail in the brain itself. And this nerve tail is called the axion. It is embedded in a very thin tube. This is the tube here. For multiple sclerosis, this tube, the official name, is myelin sheath. This myelin sheath gets nibbled at by the autoimmune inflammation. This is where the myelin sheath gets harmed. This is mostly related to a specific region in the brain, and you can see this in an MRI. When you take an MRI of the brain, you find single spots, maybe just one, perhaps 5, where this inflammation with these disturbed, defected myelin sheaths are clustered. This can be seen, and the diagnosis is confirmed. You can also do a spinal tap. You get some cerebrospinal fluid out of the back and examine that. You would also find signs of inflammation there. This is how you can make the diagnosis. And this has an impact on treatment. In conventional medicine, the relapses are treated with a high dose of cortisone. And this is correct. You can make an attack ease really fast with a high dose of cortisone. I have nothing against that. But the long-term treatment within conventional medicine is done with so-called biologicals. These are drugs that suppress the immune system. This is very effective, but will cause major side effects, because the body's own immune system gets suppressed. There is a study that showed that when patients change their diet to raw food, the number of attacks almost gets halved. Without a drug, just by changing the diet. Now, raw food is not everyone's thing, and that's why you can't just recommend it to everyone. But it shows that active substances exist in the diet that counteract the inflammation of multiple sclerosis. And we can take advantage of that in the field of integrative medicine. A good vitamin D level is also very important. I recommend my patients to take 10,000, 15,000 or even 20,000 units of vitamin D to increase the level very quickly. Until we are at the upper limit of the normal amount. Almost always these people have low vitamin D levels, and we need to increase it as fast as we can. Let's have another look on these defects in the myelin sheath. This myelin sheath consists to a large extent of omega-3 fatty acids. And that is why a supply of omega-3 fatty acids is extremely important. Let me write that down. Omega-3. It is about the special fatty acids EPA and DHA. In all autoimmune diseases, the level of omega-3 is really low. And that is why an omega-3 treatment is very important for all autoimmune diseases. All in all, we need 4,000 milligrams of omega-3. This is a large amount. A good fish oil, 2 tablespoons every day, will do the trick. This is a key for multiple sclerosis treatment. I have already said that raw food already helps a little. In plants, berries, fruits, vegetables, we have a lot of antioxidants and we can use these. There are antioxidants in the form of products, capsules, OPC from grape seeds, catechins, olive oil, aronia berries. There are many antioxidants available in a variety of supplements and products, especially if you do not necessarily want to eat raw food only. So this is part of the therapy. Then there is a special product. It is called Immunovida. This immuno product has the effect of significantly strengthening the immune system, very specifically for neurological inflammation. I have made great experiences with this. And finally, as for all autoimmune diseases, the gut must be treated as well. These endotoxins, which play a role in the development of multiple sclerosis, come from the gut, and we need to repair the gut in such a way that we can block the absorption of these toxins. There is a link below where you can learn about how to treat your gut, and I recommend you to look at that because this is a part of the therapy. Let me summarize again. For therapeutic treatment, vitamin D and omega-3 are very important. Q10, I have not mentioned that before. Coenzyme Q10, very important for the nerve cells. Then Immunovida and antioxidants, together, if it is necessary, with cortisone in the periods of attacks. Whether you still need an immunosuppressant or not depends on the course of the disease. I have several patients who don't need them anymore. For very severe courses of the disease, we do this in a combination.